Well, thank you, Bill. That's a great segue into the next part of this presentation, which will focus on the National Aging and Disability Resource Center. So what I want to do before I begin is invite my team, and I'm going to introduce all of the ADRC transition team in a moment, beginning with Sandy Quillen, our ADRC administrator from the state. Sandy?
Welcome you all today. I know you all have very, very busy schedules, so we really appreciate your time to be able to come and listen to our presentation today. And I do have two of our call center staff here today I'd like to introduce. They're in the very back row. Jim Duncan, if you wouldn't mind standing up. And John Hollinger. Thank you all.
Thank you, Sandy. I'd really like for all of you to basically see the face of the ADRC. So I'd like to go right now to my left and introduce Sharon Dickel, who is our ADRC support service contractor with Jewish Family Services. Next to Sharon, Andy Wozni from the Division of Services for Aging, our nursing home transition and care transition team leader. And next to Andy is Eddie Ashby from the Division of Medicaid and Medicare Services, and she is head of the Money Follows the Person program within the Department of Health and Social Services. So I want to begin my presentation, and then each of our team members will come up and really give you some more detail about their roles and responsibilities in care transitions. So let me begin. In my presentation, basically what I would like you to leave and take away from this presentation is a better understanding of the ADRC national initiative. Secondly, I'd like you to understand the structure, the model of the Delaware ADRC. And thirdly, I'd like you to understand the role of the ADRC in nursing home transitions, basically the identity of the ADRC as the local contact agency. And finally, I'll provide a snapshot for you on the care transition process from referral to all the way through a transition, and then we'll introduce, as I said, each member of the team. So let's begin. Again, I'm not going to go into many of all of these slides because Bill has already addressed some of the long-term care system challenges that exist. As you know, there are many challenges that have existed, still exist: the fragmented system of services, the institutional bias, the lack of focus on consumers. Often very confusing for folks to navigate. And as Bill had pointed out, the basic increase in the population, in the elderly population, which often translates into an increase in long-term care costs. So as a result of that, at a national level, how were they to meet the challenge? Why ADRCs? One of the strategies that came about back in 2003 is this ADRC initiative, which was to develop and implement person-centered, and that's important, person-centered information systems, options, counseling, and coordinated access to help people navigate health and long-term care systems. As Bill had already mentioned, you can see on this slide the long-term care history, the reform history that began with the Developmental Disabilities Assistance and Bill of Rights Act back in 1963. But what I want to draw your attention to is at 2003, when the first states were awarded federal grants to begin the Aging and Disability Resource Centers. Just some points here about the National ADRC Initiative, the background. This is a joint initiative between the two national agencies, the Administration on Aging which is one of the oversight agencies for our division, and the Centers for Medicare and Medicaid Services, CMS. That national initiative, again, began in 2003 and is continuing to the present. They were developed as a way to serve as a single point of entry into the long-term care information and support service network. And this is important. The ADRCs were developed to coordinate and provide linkages to the network of partners. They were not to supplant or replace any of the existing services, but to better coordinate services. They are considered the cornerstone for long-term care reform efforts, and all states and territories in the United States as of 2011 have at least one ADRC. So now we can say that we have joined a nationwide network. And as you can see, Delaware, which you can note over here in dark blue, has 100% of our state population is covered. We are a statewide ADRC. And in keeping with the national vision, I just want to bring this up so that you understand that the vision for Aging and Disability Resource Centers was to have everyone in every community in the nation as highly visible and trusted resources for people of all ages and incomes, and the information to provide information on a full range of long-term care support options. And again, that these are single points of entry for streamlining access to services. There are 5 core components of an ADRC, and these are replicated in any ADRC across the country. You'll have a component or services for information, awareness, and referral, options counseling, which we'll get into a little bit later when Sharon Dickel speaks about ADRC support services, streamlined access to public programs, and you'll hear this one quite a bit, as Bill mentioned, person-centered hospital discharge care transition planning. This is a project that we're currently involved in. And finally, quality assurance and evaluation. It's built in at every level. So let's move on, and I want to just point out this slide because at the core of the ADRC, these ADRCs cannot exist without strong partnerships. You'll see that it's not the state delivering all of these services alone. It is the coordination and delivery of services through a network of for-profit, not-for-profit, community-based services. We all work together to provide services, home and community-based services, and services to support individuals who are aging and who have disabilities. So you might be saying, well, so what's so different about the ADRC? The idea of an ADRC is that all populations and income levels are served, that it's a seamless system from the consumer's perspective, that there's an integration and coordination across aging, disability, and Medicaid service systems, and that we develop these formal partnerships. That's really a key, that we're highly visible and trusted to the consumer from the consumer's perspective, that we provide options counseling, something rather new for many of us out here, and that it's proactive. So I wanted to just mention at the end of this particular part of the presentation that the ADRC is more of a process than an entity. It's more of a process than the bricks and mortar of a building. You're moving from experts who work in isolation or in silos to partnerships, to co-location, coordination, routine communication, and cross-training, just as we're doing today. We're moving from a focus on eligibility and offering set menus of services to really proactive, consumer-oriented approaches, intensive outreach to individuals of all ages and all income levels, and offering comprehensive options counseling. So, as I said, and I want to reiterate this, ADRCs are not about replacing existing organizations or services. They're about building a better, more coordinated network. So, Naturally, it's all about the network. The Verizon guide, this basically says it all. As all of you who've, from the division, you've heard this, you've seen this slide before, but this really captures the essence of the ADRC. So I want to just move on real quickly to the Delaware ADRC, give you a brief overview and tell you that the division was awarded a grant in 2009, a 3-year grant, and we are now in our 3rd year of the ADRC. And I want to let you know that even though we were the 48th state to finally receive federal funding to establish an ADRC, we are now one of 15 states that is completely has a statewide ADRC, so we're very proud of that. We're moving forward. We work with an array of partners. That's how this was launched a year ago, October 2010. And we now serve as Delaware's one-stop access point for information, for services for older adults and adults with physical disabilities. Some of the highlights of the ADRC is, of course, our guide to services. Are many of you familiar with the guide to services for older adults and the guide and persons with disabilities? The print guide is in English and Spanish. It's also on the web. We probably have about 50,000 downloads of that guide, probably within several months. So I want to make sure that all of you are aware of that. We also now have a call center, a statewide call center. This is a huge step forward for the ADRC. And again, you met some of our call center staff. We just launched an ADRC website and searchable database. And I'm going to come back up and show you that so I can give you passwords so that you can become a true partner in this ADRC. The ADRC supports services, which includes options counseling, service enrollment support, and hospital discharge planning. And then I'll mention again our ADRC online referral process and partnerships. So this slide just demonstrates to you some of the formal partnerships, many of whom are here in this room, the Division of Medicaid and Medicare, or Medical Assistance, which is DMMA, our sister agency, Elder Info, the Centers for Independent Living, Freedom Center and Independent Resources, the Delaware Aging Network, which is a consortium of almost 50 senior services, and Christiana Healthcare, along with other acute care hospitals. So you'll see that the Governor's Advisory Council is also serves as our, again, as our advisory council for the Delaware ADRC. The Delaware ADRC model is very similar to all of the other models. You'll see at the core, again, that it's not just the division, it's not just the state, it involves at the hub all of our contractors as well as all of our partners, including all of you. The support service functions that you'll see on the side here include options counseling, service enrollment support, and person-centered hospital discharge planning. Sharon Dickel will explain some of that. So we often say, well, again, why the ADRC support services, and isn't this what we already do? And in many ways, you can say, yes, it is. It's a new, options counseling, for instance, is a term that we use now, but basically it is one-on-one, face-to-face decision-making support. And this is the service that's offered to all of you to help you. It's a value-added service that's available to you to help you serve the individuals, whether they're residents, whether they're in a hospital. So that's what we want to communicate at the end of the day, is that you have this resource at your fingertips. And we'll show you how to access that. I'm going to skip over this slide in the interest of time. This is basically a descriptor of the ADRC service contractor. That's Jewish Family Services is the contractor for these services, and they subcontract with other members of the Delaware Aging Network. And you'll see Easter Seals Modern Maturity Center and CHEER. The referrals can be made simply by picking up a phone. They can be made online. They can be sent in as a fax. The online referral process will show you at the end of this panel presentation. And I just took a snapshot of this. And I want to point out that this referral process is in a constant state of refinement based on the feedback that we receive from all of you. So thank you. Finally, I want to just basically touch on the fact that as of October 2010, when the ADRC launched, we were also designated as the local contact agency for MDS 3.0 Section Q survey data. So Mary Rogers will be doing a full hour-and-a-half presentation on this, and it's important for all of you to know that under that, the federal code, that nursing facilities that participate in Medicare or Medicaid programs must complete the MDS assessment of all residents admitted to facilities, including Section Q, and that relates to possible transitions to the community. And I say this for the benefit of those who are not also involved in nursing homes transition projects. And I'm going to just move right through this. The key point, the takeaway point for this is that nursing homes are required by CMS to make referrals to the designated local contact agency for any resident who, in response to questions in Section Q, indicate that they wish to talk to someone about returning to the community. You heard this on the video. So we're just letting you know that this is a service that is offered through our division, through the ADRC. And finally, this is a snapshot of a referral process with the, right at the very beginning, the referral source being the nursing home. And in all of this, I just want to show you sort of the process that takes place, and then each one of our speakers or panelists will come up and basically give you a little bit more detail. But the nursing home staff, upon a request from a resident, can simply make the referral to the ADRC. The ADRC then in turn refers this to our ADRC support service counselor. They then go out to the nursing home and begin the process. After going through a complete assessment and discussing some options, the ADRC support service counselor will then refer it back to our care transition team, and it will be it'll go through either Andy Wozni or Eddie Ashby, and the transition process will then begin. So I want to now invite Sharon Dickel to come up and basically give you an overview of what it is that they do. And Sharon, thank you.